Hello everyone, my name is Ray. I'm a nurse practitioner who specializes in cardiology. And in this video, I wanted to talk a little bit about going into more detail about the best way to check for blocked arteries in the heart, and that is through a heart catheterization. In one of my previous videos, I mentioned the three main ways that we check for blockages in the arteries of the heart. That's with stress testing, CCTA, and heart catheterization being the best. So go check out that video that talks a little bit more about it. But in this video, I wanted to specifically talk about a heart catheterization. Now, that is the gold standard when it comes to checking for blockages in the arteries of the heart. However, it is the test that has the most risks. And so what I mean by that is we don't recommend that everybody goes have a heart catheterization. That's a procedure where we go either in through the wrist, usually the right wrist or the right groin, and we put a catheter in there, do something with local anesthetic. We anesthetize the area and put a catheter that goes up to your heart, and we inject something called contrast and take some pictures with an x-ray machine. That does have risks, including but not limited to bleeding, infection, risk of damage to the kidneys because the medication that we use is called contrast. It's metabolized and excreted by the kidneys. And the more serious risks are heart attack, death, and stroke. So with that being said, again, we don't recommend that everybody goes out and has a heart cath. You know, you might be wondering, should I get a heart catheterization if I have heart disease to check? No, the main reason why we send somebody to a heart catheterization is one, if they're having an active heart attack, when somebody comes into the hospital having chest pain, and they have some EKG changes or ECG changes that look like they're having a heart attack, something called a STEMI or ST elevation myocardial infarction. Those people go directly to the heart cath. And then other people that get a heart catheterization is somebody that has severely elevated cardiac enzymes, and those are troponins. So if you go to the hospital and complaining of chest pain, you're going to get a full cardiac workup, including troponins, ECG, and all that stuff. And in some cases, that might lead to a heart catheterization, but we don't recommend that everybody has a heart catheterization. That's just reserved for the people that absolutely need it. Go check out my other video to see some other forms that we can check for blockages in the arteries of the heart, including a stress test and a CCTA. And please like and subscribe to the channel, and I'll see you in the next video. Take care. God bless you.